I have an Aura ring, and at home I have a Hume scale. That's like, it's not the same as in some of the doctor's offices, but it's really good. And it tells you that if you're losing weight, is it fat or is it lean tissue? Is it muscle? And so at least over time, it gives you an idea if you're working out and walking more. If the scale doesn't change, some people get really depressed and they give up too easily. But really, you could be transforming your body, and you're getting more muscle too. So I don't know if you want to comment if any of your patients have shared that they've tried something. CGMs also, the glucose monitors gives people a really good indication, like real time, what they're eating and how good or bad their exercise and food impact them.
Yeah, I mean, I think it's when patients don't see weight loss, they do get discouraged. I don't know that there's anything that my patients have necessarily done sort of dynamically over time besides like a full body DEXA, looking at body composition, looking at subcutaneous fat versus visceral fat. So the fat that matters is the visceral fat, right? The fat in your abdomen, around your organs, that's the hormonally active fat that causes a lot more problems. And obviously fat in the liver is the biggest canary in the coal mine, which is why we care so much about it, right? Because it actually is the biggest sign of insulin resistance in people who may not have diabetes yet. So you have a 2 to 3 times increased risk of developing diabetes. But I would say just in terms of body composition, visceral fat is really what we should be focusing more on. Naim, anything else?
Yeah, I mean, I'm a big fan of digital therapeutics, and we have apps that help patients lose weight. And Cleveland Clinic just had a study where they looked at patients with diabetes just on metformin, and they actually randomized them to standard of care or being paired with this digital app on your phone and continuous glucose monitoring. And the app will give you dietary advice, recipes, what to eat. You can adjust it, like how many calories you want to consume per day. You can say your preference. It has exercises, but also it interacts with the patients. So you're kind of playing a game, and it gives you points for eating healthy. You lose points if you didn't eat healthy. You have to log in your foods. And they showed that patients that received the digital intervention were more likely to get their A1C under good control. So I'm a big fan, and I think AI has potential to, potentially change how we manage chronic diseases and enhance the adherence to a lifestyle intervention. So I think more to come on this. One thing I started doing in my clinics now, when patients say, what diet should I eat? I say, what do you prefer? Do you want to be Mediterranean diet, keto diet? How many calories a day? Then we both go to ChatGPT. Now we say, ChatGPT, create a Mediterranean diet for 7 days that has chicken and turkey and avocados, and my patient is allergic to nuts. You get like day by day, this is what you eat for breakfast, and you're gonna get 400 calories. This is your first snack, then this is lunch, this is dinner. And it can do it for 7 days, it can do it for 30 days, you can change it. So utilize ChatGPT, it's very helpful. And actually, after you get the menu, it will tell you, do you want me to create a grocery shopping list for you? And if you say yes, you get the shopping list. So it's really helpful.
See, that's when I would tie together. Dexcom makes a Stello. It's $99 for a month, right? So I did it for like the last 5 months. I think I've been using it, and I love it. But you could put that together and share the results of that you're seeing with the diet that Chat's saying, and saying which of these are more impactful or less effective for me, and you can put it all together. It's the world's changing really quickly, and there's a lot of information available for people.